This is an exploration of Lyme disease, a tick-borne illness caused by the bacterium Borrelia burgdorferi, which infects deer ticks, presented by Olivia Cooley. Lyme disease was discovered in 1975 when scientists began to look into why so many children were being diagnosed with rheumatoid arthritis in Lyme, Connecticut. The official study was published by Willy Burgdorfer, RML, on June 18th of 1982, who found the bacterium while studying Rocky Mountain spotted fever. 800,000 cases a year make it the most common tick-borne infectious disease in the United States, having doubled its cases since 1990. The commonality of this disease has made its name known among celebrities, including Alec Baldwin, George W. Bush, and Ben Stiller. Lyme disease is caused by a deer tick infected with the spirochete or spiral-shaped bacterium Borrelia burgdorferi. Spending time in wooded areas whilst leaving flesh exposed and not removing ticks properly within 48 hours increase your chances of getting Lyme disease. To decrease your chances, wear insect repellent, cover bare skin, and help reduce the size of tick habitats. If bitten, seek a professional's help in removal, or remove it on your own, carefully. Ensure that you grab the tick by its head with tweezers and pull it out in one slow, steady motion, ensuring not to crush the tick. Then, clean the bite area thoroughly and store the tick in a jar until a professional is available. If you have been bitten by a tick recently and develop a rash in the same area in 3 to 30 days, seek professional help immediately. The rash is generally not itchy or painful, but can spread to be 12 inches across. Other early physical symptoms include flu-like symptoms, nausea and vomiting, and diffuse rashes, red itchy rashes that are associated with eczema. With the above symptoms, there will generally be no obvious change in feeling as the rashes are not commonly itchy. Later on in the development of the disease, it is common for the rashes, or erythema migrans, to appear on other locations of the body. The victim will also generally experience joint pain and swelling near the knees or any other joint. One might also experience neurological issues caused by inflammation near the brain. This can cause temporary paralysis on one side of the face, numbness in limbs, and poor muscle movement. Some less common symptoms include eye and liver inflammation, severe fatigue, and heart problems that rarely last more than a few days or weeks. Of course, the infected will also experience internal backlash from the disease. The most common effect is chronic joint inflammation. However, heart rhythm irregularities, impaired memory, neurological effects, and other cognitive defects are not uncommon. If left untreated, this disease can make life much harder and eventually lead to death. Not only is this disease painful to the victim, but it is also painful to those around them as they watch the victim's memories fade and watch them struggle in pain. Luckily, Lyme disease is both treatable and curable. If caught early on, the disease can be treated with the 14 to 21 day antibiotic course. For adults and children over 8, doxycycline is used. Doxycycline is an antibiotic that fights bacterial diseases, especially those that invoke a physical response, like a rash. For adults, younger children, and pregnant or breastfeeding women, amoxicillin is used. Amoxicillin is a penicillin antibiotic that treats internal symptoms caused by bacterial diseases. Lyme disease is still treatable when caught later on. For a late catch, a 14 to 28 day intravenous antibiotic course targets the central nervous system to cleanse it. Side effects for this treatment include lower white blood cell count, diarrhea, and the colonization of antibiotic-resistant organisms with no relation to Lyme disease. Other drug treatments are not recommended for their causation of heart and kidney failure, but include bismuthine, ibuprofen, and ceftriaxone. As for symptoms, they will need to naturally clear as the cause for furthering symptoms is unknown, but believed to be an immune response. The reasons for my choosing Lyme disease for my project are many, but I will only list a few. First of all, I had heard of the disease, but only knew that it caused symptoms similar to that of a cold, and that the disease was transmitted by a tick burrowing into your skin. Second, I was curious about what else the disease is capable of, and how to identify it. Finally, in 7th grade, someone in my class got the disease while hunting, and seeing that Oregon is a nature hub, I figured it was important to remain protected and safe from the disease.